Does that feel the same on both sides?
Yes, ma'am.
And then lift your toes up towards the ceiling,
Mhm.
and then press down like you're stepping on the gas.
Yes, ma'am.
Kick your leg out at me.
Mhm.
And this one, kick your leg out.
Do what now?
This one here.
Oh, this one
kick
there?
your
Oh,
leg
yeah,
out.
sorry. Okay.
That's okay.
Okay.
And then take this knee and bend it up like this. Don't let me push it down.
Okay. Bend it up. Okay.
Yeah. So it's hard to keep that one.
Yeah,
up.
it is a little bit. Yeah.
Okay.
Uh-huh.
And then this one.
Yes. Okay.
Okay. And then does that feel the same on both sides?
Yes.
Okay. And then one more thing. Touch your finger to your nose like this.
Which one? My right hand or left? Is that?
Yeah. Just
Right,
either is fine.
Okay.
And then touch my finger.
Okay.
Back to your nose. Back to my finger. You can look at my finger. It's okay.
Okay.
All right. Now we'll do the sand.
Okay. And your finger first?
Sure.
Okay.
And then go to your nose.
Sure. Whatever you want to do. Okay.
Then go
All
to
right.
your
Okay. And then what? My nose? And then my
Your nose.
Right. Okay. My nose. Okay. Okay.
Okay.
All right.
And then, there we go. Okay.
Okay.
Great.
Okay.
Okay.
All right.
Okay. Have you seen your MRI scan?
Not the last. Not the. I don't know if they've shown us. They haven't shown us anything for a while. They did one other one after surgery, I guess.
I mean, they have like in this chart is they'll have like the notes, but they don't have any images of anything.
Yeah. And just.
Okay. Well, I can show you.
I know the right lobe was larger from what if you have.
So this on the right
Okay.
is the MRI that they did prior to surgery. So this is from
Okay.
April 15th.
Wow.
So this is a slice through your
Oh, look
head
at
like this, from the front to the back. So this is your forehead. This would be the back of your head.
Okay.
This looks like the left, but it's actually the right side because it's just reversed.
So the
this
forehead is here.
forehead
you're
is
saying?
here.
Okay.
Yep.
Okay.
The back of your head. This
Okay.
is the right side of your head. So
Okay.
this is the tumor
Wow.
right here.
Man.
So this is kind of like the lower part of it. And then when we, as I'm like scrolling up now towards like the top of your head, that's what it looks like. This looked like, and then this dark around it is all just swelling. So it's just swelling that the tumor was causing. And this line is normally just straight down the middle. And it was pushed a little, you could see the pressure is kind of pushing it slightly over.
Maybe that's what they were talking
That's the
about.
midline shift
Okay.
that they're talking about. It's pretty small, it's just a couple millimeters.
Okay.
And then this is the MRI that was done on the 22nd, right after surgery. So you can see that line is now straight again. So
Okay.
they removed the mass, the vast majority of it, at least of this portion.
Right.
You
Okay.
still have this resection cavity, so some of this brightness that we see is just like inflammation and blood products from the surgery.
Okay.
And then the darkness inside, some of that is just a resection cavity. The swelling around it, this was like pretty soon after surgery, so you still see some of that swelling. So there is essentially always cancer cells left behind, even if it looks like. It's always hard to know if it was really completely removed because you can't see these tumors very well. Like this surgical cavity can sometimes look just like tumor would look, so it's a little hard to interpret. And the inflammation can sometimes look like tumor infiltration. So it's hard to interpret just scan alone. But we know even when it looks like on the scan it's completely removed, there's always cells left behind.
What about
These tumor cells. And so the way the standard treatment involves using radiation therapy to target the whole area where the tumor was and all of the kind of swelling.
Can I ask about the
around it.
frontal tumor? Sorry, my voice is kind of bad right now.
This is like frontal kind of parietal. Let's pull up a FLAIR image. Like this is still kind of extending into the frontal lobe.
Okay.
But let me see.
And this was about this one. I know this one was, but the other one you're not. I don't know if you can see that one. They said that smaller one that's on the frontal
This.
lobe. Is that it? Is that the?
Yeah, this
Okay.
is what they're
Oh.
talking about here.
Okay.
And so this is a different type of a scan. This is a FLAIR sequence, and so this does a better job at showing things like inflammation, but also tumor involvement that is not shine bright like this. So you couldn't really appreciate that area as well on this scan. when you look on this, that really kind of pops out. So that's the other area right there.
Okay.
And that's for sure a tumor, because I know there was like questioning at the beginning if it was or wasn't.
Well, it looks like it.
Okay.
Because this is kind of a limited sequence in terms of the scans. Let's look at this one too. Yeah. I mean, it's not uncommon that for these types of tumors, that you have like multiple kind of foci of disease. And so, unless it was proven otherwise, we sort of have to assume that it's tumor. And it looks like it, like the way these tumors do look.
Now, for the glioblastoma, is that the one where it's kind of it's kind of the way that, is it the way it grows? The tendrils or whatever are on it, or grow? It's hard sometimes to get all of it. Is that kind of
it's not encapsulated, so it's like going into
the cells basically kind of just invade
right.
the normal brain.
Oh my God.
Yeah, you can't just cut that out or anything like precisely
like kind of far. And that's why I was saying when it looks like it's we know that those cells were there.
Right.
And so we use the MRI to target all the areas that are suspicious for, or we think could potentially have those cells in them. And the radiation is an invisible, painless treatment.
Mm-hmm.
So it basically, you lay down on a table and it sort of feels like you're getting a CT scan or an X-ray.
Mm-hmm.
A big machine moves around you. You don't go into a machine. You're not in an enclosed space like you are in the MRI. But a big machine that's kind of up more towards the ceiling moves around you. You can't feel anything during the treatment. It generally doesn't make you sick. Really, you just, it's like you lay down and got a picture taken. You can't tell
Doesn't make his hair fall out or anything?
Well, over time it could. So with each treatment, is kind of what I've just described. But as you go through, so it's a series of daily treatments, Monday through Friday for 6 weeks.
6 weeks, okay.
So about 30 treatments in total.
Okay.
And you get a little bit of radiation each day, and it builds up over the course of the treatment. So in the beginning, as I mentioned, you usually don't notice anything. But as the dose starts to build up, you can feel a little bit of fatigue.
Okay, a little fatigue. Okay.
Yeah.
Okay.
You can have hair loss in like patches, kind of over the area.
Yeah.
And then the skin underneath can get a little irritated, dry, red, itchy. But all of that is generally pretty mild.
Yeah. So basically, this is just what you're able to do is more of a more. With this is more just you're able to target instead of just blanketly do radiation on the brain.
The proton radiation is more.
So the difference between proton and like conventional radiation.
Yes.
So with either of them, they're pretty much targeted to the same area. Like we would target, like let's just say we were using this scan, we would kind of target a region like this.
Okay.
It would kind of go something like this. So it would kind of encompass all of that, all of the regions, and that area would mostly be the same, whether it's proton or photon radiation. It's going to kind of get the higher dose radiation, the dose we want, to that same area.
Okay.
But what protons do is that they deliver less radiation to like the surrounding areas. So there's less radiation to like this side of the brain.
Oh,
right.
Yeah.
Okay.
And in some instances that can be really important and very helpful because it can help. Basically, protons aren't better at treating the cancer. They're not better at curing the tumor or preventing it from going back. So the efficacy is the same.
But it's just not going to be damaging potentially to the rest of the brain.
It's just that the main benefit of protons is usually to just try to reduce side effects of treatment.
Okay.
And it doesn't reduce the hair loss or the the fatigue necessarily, but the main things that it can reduce are long-term side effects like impact on thinking or with cognition.
Yeah.
And the truth is for your tumor, it is located. Let me give you a different.
Did you know what happened in one time when I was in the hospital? And this kind of scared me for a second.
Yeah.
They said, okay, they asked me, they just said, we just have to ask you, who's the president? And you know, for that moment, I had no idea.
Yeah.
And Nixon came to mind. You know, and I was like, and,
His
but I was
time
like-
traveled.
But it's weird. It's a weird thing when your brain blanks for a second.
Yeah.
You know what I mean?
Yeah.
And I was like, wow, that's very strange. Wherever this is going, I don't know, but that's really weird.
Radiation, this is just another view where
Okay.
you're looking like